Hey everybody, Dr. Greg Jones here, and today my guest on this very new podcast is so new that I don't even have a name for it. It's just me talking to people, holding conversations, and just kind of, geeking out over things I love in medicine. And so my first guest today is Dr. Linda Hayes. Um, Dr. Hayes, actually someone else said, hey, there's a pharmacy, you need to talk to Dr. Hayes. And I talked to Linda and I talked to her and we just immediately like bonded over peptides because I'm like the biggest I'm pretty, not the biggest, one of the huge peptide nerd. Is like when you start talking about that, I'm like, oh, what about this? And how do we combine this? And it was just a great conversation. I was like, man, I really wish I could record this conversation and people can hear it. And I was like, wait a minute, I can do that. There's the technologies there. We have the technology, we can build it. So Dr. Hayes graduated from the University of Michigan in 2005. So I grew up in Illinois, spent some time at the University of Illinois. So I'm not going to hold that against her, but hey, you got to do it. You got to do what you got to do. She's currently, the founder and I don't know what you guys call it in that world, pharmacy director, head pharmacist, but I'll let you cover that at Pure Pharmacy. Dr. Hayes is extremely passionate about achieving positive patient outcomes, especially through individualized, innovative compounding therapies. So with that being said, she's an expert in hormone replacement, adrenal health, genetic and nutritional testing, and especially peptide therapy. And that's what we're all here to talk about. So this is our Peptide 101 with Dr. Hayes. Would you prefer me to call you Linda or Dr. Hayes?
Linda's great.
Okay, so we'll be Linda for today. So first of all, anything you want to add to the introduction before I start grilling you on the peptides?
No, I think you pretty much well covered it. So let's start grilling.
Okay, perfect. So first of all, the question I always get is when a patient's in front of me, it's like, hey, I've got this great therapy. It's called peptide therapy. And they're like, oh, I've heard of that. Or they're like, well, what's a peptide? And so when you're asked that question, how do you answer that?
I get asked that question in different ways. And so basically, I just tell them that, first of all, insulin is a peptide in our body. So we have over 7,000 naturally occurring peptides in our body. And they are not just, they can be hormones, messengers, enzymes. They're all different things. Basically, a peptide is when we have amino acids, the building blocks of protein. So when you have two amino acids that form a peptide bond, that form a bond together, that is a peptide. And what I like, some will say, if you look up at Wikipedia, they'll say peptide is defined as less than 50 amino acids. I've seen peptides greater than that. And I think, and some will say peptides are a linear strand of amino acids. From my experience, it's not that it's a linear strand. It's that once it becomes 3D, that is what becomes a protein. So they are the building block. So you've got amino acids, building blocks for the peptides that become 3D protein structures.
Okay. Got it. And so one of the ways I kind of go, maybe not as much detail as that. I'll just say, hey, you remember chemistry, there's amino acids, there's peptides, there's proteins, right? So your peptides make up proteins. And I go into this whole thing and I'm going to lead into that about, well, they're like, okay, what's so special about that? And then we'll talk about, well, in the way and again, for me, a lot of times I think the mark of being a good communicator with our patients is how do you take this complex concept and make it simple, right? And so I always start the conversation with, a peptide, between a peptide and a medication is me giving you a fish. A peptide is teaching you how to fish, teaching your body how to fish, right? So essentially, now if I can give you medication, your body's going to respond to it and you're going to take it and it's going to, hey, I use this up. I either bind in the cytoplasm or whatever, I make something happen. Whereas if I give you a peptide, it's going to bind to the surface of a cell and through second messenger systems, it's going to signal the body to do something, to make something of its own. And that's a huge difference, with, specificity, right? So I kind of, I like what you said. Now I can kind of wrap that in and just, if someone
I like that. I like what you said. Yeah.
Yeah. We can just, break it down so people like, oh, that piques their interest, right? Like, cause everyone knows that analogy about the fish and, giving you a fish and teaching you how, right? So with that being said, that leads me into my next question for you is, what is the advantage in your perspective of a peptide over a medication or even a hormone replacement therapy or supplement?
Supplement, that kind of thing. So basically, as we said, the peptides are naturally occurring in our body. So we're trying to, a lot of times we'll find that we're maybe deficient in a certain one, or like if we're doing we're doing a couple of different regenerative peptides, it's going in there and helping to regenerate, a joint or what you're doing. And So we're naturally helping the body to heal itself, as opposed to giving a medication or a supplement. And I'm not dogging all medications or supplements, because there's
Yeah.
places,
Oh yeah,
but
sure.
and peptides also, they're another tool in your toolbox, so that you might need to combine supplements. I think medications in some respects may come last to this when we're talking about functional medicine, but you might need to combine some supplements with the peptides. And a lot of times we might even need more than one peptide, or a different combination. And we call those, different protocols. So.
Okay. Got it. And so, that being said, the great benefit, clinically and all that, a little bit safer alternatives. So many cool things we can do it in practice, do with peptides in practice. But one of the questions that I get asked a lot is, well, Dr. Jones, you're always talking about peptides. You love these peptides. Then, well, who shouldn't be taking peptides? Is there a population that should avoid them, or think twice, or, make sure that they're looking at all the factors before starting peptide therapy?
So I think it depends on the peptide, of course, just like
Mhm.
supplements and medications.
Right.
So I think in general, be cautious with a patient who has cancer. Now, there are a couple different peptides that we use to help with cancer, though. Specific, IRGD, PNC127. But with that being said, you want to be careful with the history of cancer or actually active cancer in general.
Now we're going to circle back around to some of our favorite peptides here. Excuse me, getting a little clear my throat there a little bit, but we're going to circle back around to this. But one of the peptides that, we do a lot of in my practice is with the growth hormone secretox, right? So
Yeah.
your CGC 1295 and Pamorelin and all that. Is there a caution with those with people with a history of cancer?
I guess
Yeah.
if there's a history, I am very cautious about that.
Yeah. Mhm.
Especially if I use about the 5-year mark.
Okay.
So
Okay.
yeah.
Definitely. So, so these, again, like, one of the reasons I want to talk about is that, because when I have this conversation with patients about peptides, it's like I get all excited, like, oh my God, they're good for
Yeah.
building muscle and losing fat and improving your skin and your hair. And it just goes on and
Sleep
on and on.
better, right.
Oh God, there's so many things right there. Right. So kind of want to talk, in your opinion, some of the best peptides. And we talked about different categories, right? So the first
Right.
one I want to talk about is, in your opinion, some of the best peptides for, body composition, fat loss, and, building muscle. So our athletes out there.
So generally, I think there's two great ones I think to start with. First one that I really like is the CGC Ipamorelin, the growth hormone secretagogues. So one works to increase growth hormone in the pituitary. The other works to release it about 20 minutes later. So you're getting this increase in growth hormone and time release. So that is just your general one that is going to help with everything we just talked about: mood, feeling better, repair, sleep, anxiety, depression, all of that kind of stuff. It's just going to help in general. So that's one of my favorite. The next one, it's more of an immune peptide. I do a lot of this one too, is thymosin alpha, and that is just to kind of balance and support the immune system. That's another one I do a lot of. However, I will say CGC Ipamorelin is probably my favorite basic one to start with.
Okay.
If we're going to go more towards, body contouring, weight loss, there's a couple other. I do like tesamorelin. It's kind of actually one of my favorites. And that is the same thing, same category, GHRH, as the CGC 1295.
Right.
So so what's ideal is to be on the CGC Ipamorelin, then maybe throw in a course of tesamorelin and ipamorelin, maybe 4 to 6 weeks.
Okay.
Up to 8 weeks.
Okay.
So
Got it.
Mhm.
Yeah. So most people know that I've got a little education on peptides, that this is, the CGC Ipamorelin and a lot of those growth hormone peptides, they're subcutaneous injections, but I have seen some formulations where there's oral forms and troches. What do you see in the difference between the injectable form and the oral?
So the problem is if we're doing oral, they're not really bioavailable orally. And that's where Big Pharma failed years ago to do all these, is they were trying to get them so orally bioavailable. So even if you're going to put it in a troche that dissolves under your tongue, you have to heat up a peptide. And some of us know when we heat up a peptide or a protein, it's going to break down. So if we have to heat it up, it's just not going to work that way. It's not going to be as effective. And so definitely subcutaneous is the better way to go. I have a new study that I'm looking at that says nasally for CGC for Marlin.
Wow.
I'm looking into that. I don't know for sure yet. So we'll see. So nasally, I mean, nasal option, it seems to be a interesting option. So we'll see. There's some others.
Yeah, I'll be on the lookout for that as well. Just because I do run into the occasional patient that's like, man, doc, I really want to try this, but I am not trying to be putting a needle in my, stomach or leg or whatever, 5
Right.
times a week. They're just not they're not about that life. So
Right.
other options to make sure they can benefit from it is always a good thing.
Mm-hmm.
So the next category is injury recovery, right? You kind of mentioned, so the tendon, ligament healing and all that. What would be some of your favorites for that?
Definitely BPC 157. And the combination with thymosin beta 4, they really help a lot for repair, any kind of tendonitis, joint issue. Also another, I'm getting a lot of good feedback on just BPC and a cream by itself, and a transdermal cream.
Okay.
So for like tendonitis, elbow, wrist, that kind of thing.
Okay. Now with those, just from what you've seen clinically, is about how long before the patient starts to see some results from that? Because, obviously they're not going to get it right away just on the first injection.
Honestly, for the BPC cream, it has been, about 2 weeks. Okay. In terms of like the BPC thymosin beta combination, I've used that for tendonitis in my Achilles and my shoulder. Sometimes I feel better, like for my tendonitis in my Achilles, I'll feel better 80% after I inject it, like that actual first initial injection. Okay. Everyone differs. Sometimes I don't feel better. So, and sometimes I'll use it consistently and sometimes I don't. So, but it definitely helps.
Okay. Now, another question with that is first peptide trainings I had, they mentioned you were injecting for injuries to inject near the injury. So like I've had a knee, you want to get close to it, or shoulder. But then I had, another educator say, no, that's ridiculous, right? It's a subcutaneous, look how little that needle is. If it's your joint, you're not getting there, right? So is there an advantage especially with the injury recovery peptides versus, systemic injection, subcutaneous versus getting near the injury site? Have you seen anything with that?
I've gone roundabout with this. Okay. Whether you should just always inject in your belly or inject near the site of injury. Here's the thing. If you have multiple sites of injury and that BPC is supposed to know where it's supposed to go, it's it might not go to the area you want it to go to. So that's why I say kind of inject near the area. Okay,
cool. That's pretty, because again, now you mentioned like an ankle, that's kind of hard because there's not a whole lot of subcutaneous fat.
You have to go up higher above the Achilles for sure.
Yeah, exactly. Trying to get a fat pad there and work with it. So next category, and I'm going to combine these, are skin and hair.
Oh, skin and hair.
Yep.
So I am feeling a ton of the PTD DBM. I know it's kind of crazy, but that is at 0.001%, and we use it as a spray topically. And some use microneedling with it, some don't. And then second after that, the PTDBM spray, you're going to use valproic acid. And I do have a physician that prescribed it for her Pomeranian that has alopecia. And I can probably send you the pictures from the before at day 1 to 30 days later. This dog grew hair. I was shocked.
Okay.
So, but that is actually the #1 go-to for hair growth right now. There's also the tricopper peptide, the GHKCU. I've had some have results with the foam and that kind of stuff. You could essentially use them all together, but right now I'm feeling a ton of the combination of the PTD, DBM, and valproic acid.
Now, do you compound those together, or are they two separate peptides?
No, they have to be separate, and they're supposed to be applied separately. So. Okay,
gotcha. Now, with the PTD, DBM, I've been using that post doing hair restoration injections. So I'll inject. I got all these, created a bunch of, inflammation up there for my injections. I'm spraying that on there. Maybe it's just a spray I had. It didn't really come out like a regular spray. It was like little drops came out. And so we just kind of rubbed it in and all that. So now is there a particular timing with that, with the PTD DBM? Is this like a bedtime thing, or is it
bedtime?
Whenever? Okay. Gotcha. Next one, hormones, hormone replacement. So I know there's I've been looking into Kispeptin. I've been looking into, I want to say it's the 7-keto DHEA, I believe is another one that I've been looking into. There's a couple out there, but
Yeah.
wanted to see if there's any options for hormone replacement in the peptide world.
Yeah. So especially with us not being able to compound HCG, where a lot of us are switching over to Kispeptin, and we'll see. I've just started a couple patients. What I'm curious to see is to make sure that the free testosterone is going up on these patients.
Gotcha.
We have not seen the clinical data for that. So actually my husband just started Kispeptin, I think yesterday.
Okay.
So he will definitely be able to see with him. So.
Okay. Yeah, because last I heard they were doing some clinical trials or some early clinical trials on Kispeptin, is because with HCG kind of coming off the market from the compound pharmacy perspective, it's like, okay, what are our options, right? So I'll be excited to see if that's
well, and it's Clomid, for example, that can increase testosterone, but that doesn't mean it's making them feel better.
Right.
Also, so we have to, I think Kispeptin's kind of newer like that. We've kind of known about it, but we just haven't gone to it. So.
Okay. Yeah. And I've got some younger patients that I've had the conversation about HCG versus Clomid, and I've had some good results with enclomiphene, which is another, isomer of Clomid. And so, but I also caution that, like, hey, there's a ton of great data that this is going to increase your total testosterone free. Yeah, not so much. So your numbers are great, but you may not feel great. And depending on the patient, they're like, your numbers are great, dude, but I can't work out with these numbers.
So my husband's testosterone, it actually went down since he started some therapy. It's kind of, I don't know if it's stress or whatever, but since he's been on CJC ipamorelin it took him about 6 to 8 weeks. He's like, man, I just feel better. I'm getting leaner. And and that's without the testosterone. He's 41 right now. So.
Okay. Gotcha. And last but not least, what about sleep?
Sleep is, sleep is interesting. We have a couple different ones. So when I initially started learning peptides through the peptide certification through A4M, so DSIP, DSIP, Delta Sleep Inducing Peptide. They thought that was going to be the cure-all, the most amazing. However, clinically, it didn't put patients to sleep. It wasn't like their Ambien, that kind of thing. So what we found out really clinically is that it's resetting the circadian rhythm. So it's not necessarily helping with sleep, but it's helping with stress because it's resetting the circadian rhythm. So actually during COVID, all this stuff, I had some prescribers of, they were prescribing a lot of DSIP for their patients. And another one is ipithalin, the more of immune peptide, but at a lower dose. And I haven't, for me personally, I have not, I've prescribed, I've filled it for some patients, but I haven't gotten much feedback on it. So I don't know how well it works. It's supposed to work pretty well, even better than DSIP in terms of sleep, but I don't have the clinical knowledge there for that one yet.
Yeah, I've been running kind of an N=1, testing myself with the epithalon, taking it, I really honestly haven't noticed a difference with sleep. Then I went to like a morning.
The 300, the 300 mics, the smaller.
No, I went for the big boy. I was at the 10. Oh yeah,
and
I was going all out. No, I think it was a 10 milligram. Yeah, I was doing 0.1 of that, and I was like, oh, let's see what happens, right? And I didn't necessarily notice anything with sleep, but when I do take it in the morning, I do feel a lot more. I don't know. I feel calmer during the day. I know it doesn't really have that effect. I was kind of like, well, one of the reasons why, obviously the anti-aging, the telomere lengthening portion of that's always good, but that's something you ain't gonna feel that. You're not gonna feel a telomere.
No, right.
But I also know, I've read a couple studies that talked about the epithalon working on making and correct me if I'm wrong here, making the hypothalamus a little bit more sensitive to hormone replacement. So making the HRT more effective, right? So I was like, I wonder if that's where I'm seeing the benefit. Sorry, I literally just got caught in the microphone. That's great. So, so there's, again, the great thing about these peptides is so many of them are pleiotropic. So they have so many different effects that,
for sure.
sometimes you can't, and we're all different, and so some people may react different to the next. You mentioned COVID, which leads me into the last category I want to talk to you about, which is immune support.
Yes. Oh, immune, definitely thymosin alpha-1. That's huge. That has, we can't stop filling thymosin alpha. And some patients, they just feel better right away taking it. There's a select few. If you're going to have a reaction to thymosin alpha, your immune system's really active. It's really overactive. I've only seen that in a handful of patients. So mostly patients do not react to thymosin alpha. And if they do, they're really their immune system's really hyper overactive. So.
Okay. Gotcha. What about the LL37? Have you seen anything?
LL37 is a great antimicrobial,
Mm-hmm.
and it can be used to treat any kind of, flu, virus. Also, we have a preventative dose. We use it in Lyme's disease as long as we have the immune system kind of calmed down with Lyme's disease, and that is at a lower strength. You go a higher strength twice a day for any kind of active infection. So I know for sure we were treating some patients with COVID with the LL37. So.
Okay. Sounds good. So there's so many peptides and so many ways
Yes.
to use it. We can go on and on and on and on. And trust me, I love talking about this stuff. But
Yeah.
so I wanted to, we've mentioned a few, but if you were stranded on a desert island, and you were like, hey, I got to take 3 peptides with me, or I'll even give you a break here. If you can take 3 peptides or peptide combos with you, which would you take?
Okay. So, like typically I would say in general, CJC ipamorelin, but I love tesamorelin and ipamorelin. Like I just feel much better on that one. But I know for prescribers, especially starting off, they would want to start with the CJC ipamorelin. So I tend to, but you said deserted islands, so I have to be honest.
Yeah, no, that's fine. That's fine. Yeah, I call CJC ipamorelin. That's my gateway peptide for people. It's like, you try this, trust me, you'll be back for more. So, okay.
And so definitely the tesamorelin and the ipamorelin combo. Honestly, my newest favorite is the Melanotan. It was hard for me to get on it actually at first. It kind of made me a little nauseous, and it will for some patients. You have to take it with food if that happens. Some don't. Most are totally fine, but occasionally some get a little nauseous. Inject it around the time you have food or at bedtime, and then some people complain about some spots from the Melanotan. Those go away. They go away. So I'm pretty fair. But everyone keeps saying, oh my gosh, you're so tan. I'm like, I've been in the sun for 10 minutes.
Yeah, and I want to hit pause really quick because I had a patient on the Melanotan and she started getting spots. She's like, I don't want to do this anymore. And I was like,
I did the same thing.
Okay, so before we go forward, a lot of people that are going to listen to this, they don't know what Melanotan is or what it's for. So if we want to circle around to that really quick.
So yeah, we didn't mention it before. So Melanotan is interesting. So a side effect of Melanotan is it helps you tan. So, and some patients just want that, but it also increases libido and it helps with weight loss. So when I inject it, now I'm only injecting about 3 times a week. Initially you do it daily for 2 weeks and then you go to 2 to 3 times a week at whatever. It depends on what you want to use it. And you also have to base it on how tan you're getting too. So some people with more melanin, they're going to get darker much quicker than me who's fair skin. And so, some patients, so I've just heard this, it's called the Barbie peptide. So because it helps with tanning, libido, and weight loss. For me, it curbs my appetite in the next day. I don't want to eat as much. And so I'm like, well, this is nice now. I'm not getting nauseous. I just don't want to eat as much the next day. But, so that is one of my kind of favorite ones now. So.
Okay. And while I have you on the line here now, is there a kind of a dosing protocol with that? Because I've seen some places where you want to do like a loading of the Melanotan, and we're talking Melanotan 2, right? Not
Melanotan,
right. Like a loading dose of that, and then you want to kind of taper that down.
So usually, we suggest like 15 units daily for 2 weeks, and then the traditional, what they say is 25 units twice a week. For me personally, I like to do 15 units 3 times a week. So a little bit lesser. And 3 times a week. So, and also I mentioned this. So it also, where people don't, the Melanotan 2, it's part of the melanocortropin system. I had my student looking this up today. It's huge in the immune system too. So it does help with the immune system. So.
Okay. Wow. That's new to me too. So I definitely.
Oh yeah, no, it definitely. So.
For sure. All right. So you got 2, you got 1 more in your bag here.
Oh boy. BPC. BPC 7. And I would say orally with the capsules for gut health. However, injecting it, with the tendonitis in my Achilles and my shoulder and stuff, it's a game changer. So yeah, I really like that.
Okay. Well, thanks for that.
Oh, can I say one more now that I think about my son? We haven't talked about neurocognitive. Dihexa is huge. It has been a game changer for my son. So I will just say that.
Okay.
So.
Yeah, I know we didn't. That's why it was like one conversation. I may have to get you back on here because we didn't talk about C-Max. We didn't talk about C-Link.
No, nothing neurocognitive.
We haven't gotten cerebral lysin. We've got so much more. Yep. So there may be a part 2 to this. So just be on the lookout. So one of the other things I want to talk to you about is that, even for me, because I always feel like sometimes I think my computer is watching. They are watching us, so forget about it, right? So I'll be on Facebook, or I'll be looking at some random website, and it's like, boom, buy your peptides, right? I'm like, oh, I'm curious. I love my peptides, and I'll click the link, and it's like, oh, you're just selling these peptides without a prescription, right? I can just order this, and then you go a little further than it says, oh, for research purposes only, don't inject into humans. I'm like, so, and then of course, as a doc, you're getting we're getting the compounded, the legit peptides. And I'm like, okay, it costs this much. And they're like, dude, I can get that for $50 off the internet. And I'm just like, good luck with that.
It is not the same quality.
Exactly.
Patients will tell you they will feel so much better on the compounded, from a quality pharmacy that has compounded it. So what has happened is, so people who make these peptides, if they get a bad batch, they will sell it to quote unquote the black market. That is the internet companies, whatever. Or if they're using it for research purposes, they don't have the same CGMP processes that our FDA approved manufacturers do. So there's, so you've got sterility issues and potency issues with, whatever you're buying on the internet. Whereas we as compounding pharmacies are we have to abide by FDA regulations. So.
Yeah. And
and that's huge.
For what it's worth, whoever is listening to this or watching this, stop buying things off the internet and injecting it into your body. Are you crazy? Like
injecting it,
literally, it's not a supplement. Like literally, it's an injection. It's going into your circulation. Like I can't stress that enough. It's just not worth it. And again, Dr. Edwin Lee, I was listening to one of his podcasts, and he's talking about like the actual. You mentioned sterility, like the process of synthesizing peptides is not exactly a clean process. You have to do all these sterility procedures, or you're running a risk of toxicity, right? Why risk that? And if you did get the reaction, who are you going to call? They're going to pick up the phone, So, all right, so I'm going to shut this rant down, and hopefully.
Well, and I get questions all the time, like, if they have a certain reaction, like they need to be able to call me. They need to be, maybe you need to take, something for this. You've got a histamine reaction going, you need to use this. And so you need somebody to call to be able to talk to you about it. It's just like, it's not a medication, but it still is, it should be treated like a medication. Doctors prescribe this, there are protocols, there are, safe ways to use these peptides. You can't just think like, I'm just going to go do this,
For sure. No, I appreciate that. So I want to thank you for the time here. This is our take 2. This time is actually working. I'm highly appreciative of that. So again, in closing, is there anything you want to, put out about, the pharmacy, how to contact you, all the great closing of a podcast things that,
So I have started the pharmacy. It's called Pure Pharmacy in Carmel, Indiana. Our address is 12425 Old Meridian. It's Suite B as in boy -3, Carmel, Indiana 46032. Our phone number, if you want to get in touch with us, is 317-740-1856. And my name is Linda Hayes. I've been studying these peptides for over about 18 months now. So it's not an easy concept at first. It's a lot of training, it's a lot of work, and I also put a lot into genetics with the peptides that we didn't really talk about too. So, but that could be peptide 102. So
yeah, I know we got to keep building upon this. So, well, thanks a lot. I appreciate the time, and we'll be talking to you soon.
All right, take care. Thanks.
Thanks. Have a great night. Bye.